All right. Well, thank you everyone for joining. I wanted to just this is a new to Children's Heart Link, and that's to celebrate International Nurses Day as a webinar and have you meet some of our amazing volunteers and partners. And so thank you so much for joining us. I'm Erin Busch. I'm the Vice President of Development for Children's Heart Link. And for anyone who's new or who will be listening to this as a recording sometime soon, I will tell you that Children's Heart Link is a nonprofit, and we are an organization that partners medical volunteers with doctors, nurses, and healthcare professionals to help underserved communities around the world to really improve pediatric care and programs. And our focus is really on building at the local capacity through the train the trainer approach. And our goal is to focus on long-term relationships and mentoring so that we create sustainable access for quality care for children with congenital heart disease. And so much of our work, almost nearly all of our work, is made possible through philanthropic support. And so that is why I'm absolutely honored to introduce you to Jeff Busch and extend our deepest gratitude for the Mary McMahon Busch Fund, Nurse Training Fund. They really have done amazing work with us and really have been with us for so many years and have helped nurse training really excel. So, Jeff, would you tell us a little bit about Mary's legacy and the reason why your family is supporting our nurse training efforts?
Absolutely. Yep. Thank you, Aaron. Um, Mary served on the board of directors of Children's Heart Link when we were living in Minnesota, and she was working in the cardiac device industry. And Mary had been a nurse by training and became this international business powerhouse in the cardiac device business, which was really unusual. And she loved serving on the board of Children's Heart Link and was grateful to all the volunteers, such as yourselves, who pitch in and do what they can to help train more nurses around the world in divergent cultures where nursing may not be like it is in the United States. And um, our family is deeply grateful for Children's Heart Link naming the fund after her. I wish we could do more to support it. We do about as much as we can, and we're constantly trying to figure out ways to increase support for this program. Um, Mary was such a strong advocate for nurses her entire career, to the point where during the years we lived in Minnesota, she never let her Washington State nursing license lapse. She had this dream of someday retiring, coming home, and getting back into nursing because she felt so strongly about it. So it was an important program to her, and it's an important program to our family. And we appreciate all that you do. Thank you.
Thank you, Jeff. So, with that, I'm going to hand it over to Anna Fisk, who is our moderator. Anna has her PhD, RN, CRN, and is clinical coordinator for the cardiovascular intensive care unit at Boston Children's Hospital. And she has been a medical volunteer with Children's Heart Link for more than 12 years, I believe. And she has worked with our partners in India and has served as a scientific advisor for our Pediatric Cardiac Intensive Care Society. So, Anna, I'm going to let you take it away and introduce our other panelists and start this conversation.
That's
Thank
great.
you.
Thank you so much, Erin. I'm really excited to be here. I'd like to welcome everybody and really extend my gratitude and our gratitude for everybody who's supported Children's Heart Link and the Mary McMahon Busch Fund. We couldn't transform heart care without donor support. As Erin said, it's enabled me to meet nurses from throughout the world, mostly in India, as you heard, but really learning from them and having the ability to share my knowledge to try to improve cardiac care. Nurses comprise the largest segment of the healthcare workforce in most countries, and in pediatric cardiac care, they are the biggest part of Children's Heart Link's capacity building. So today we have the unique opportunity to hear from Children's Heart Link medical volunteer and a partner to learn how this bidirectional learning model is impacting how they practice and how the people around them practice. So the first one I'm going to introduce is Jody Dahl-Wilhelm, who is an advanced practice RN and a family nurse practitioner and a cardiovascular surgery intensivist at the Mayo Clinic in Rochester. She has volunteered with Children's Heart Link for 10 years.
Thank you, Anna and Jeff and Erin and all of Children's Heart Link for having me. I'm really honored to be here for such a special event and an opportunity to really honor the nurses as they're truly the backbone of patient care and outcomes. I started my first trip in 2015 to Brazil, where I got to meet and work with Bruna. Was there for a few years and then transition was at. I was then invited to be a part of a site assessment for what would be, and eventually right now currently is a future partnership with GKNM in Coimbatore, India. Started with a small group. I've been going there ever since in any form of multitude of training sessions, whether it be small groups, large groups, combination of groups, Zoom meetings, you name it, we've done that kind of learning. So I'm really looking forward to today's conversation.
Thank you so much. And since you kind of introduced our friend Bruna, she is a nurse and has a master's in nursing and is the nurse coordinator and scientific coordinator at Cardioped Brazil. She's led the nursing team at Children's Heart Link First Center of Excellence in Brazil. So we want to welcome Bruna.
Well, thank you. Thank you everyone for the opportunity to be here today to again honor the nurses and be thankful for all that Children's Heart Link have done for us and all the volunteers and all the donors that without them this would not be possible. I have been with Cardioped Brazil since 2011. And they have been partners with Children's Heart Link since 2009. And I can say how much, we've grown with the volunteers with Children's Heart Link. And well, I'll tell a little bit about it later, but we're just so thankful. So thank you for this opportunity.
Thanks, Bruna. Jody, let's start with you. Children's Heart Link's primary goal is to develop a skilled, competent, and motivated nursing workforce to provide the highest quality care to their patients. Children's Heart Link aims to improve the quality and recognition of the nursing profession. In the years that you've been volunteering with Children's Heart Link, how have you seen the nurses you partner with evolve individually and as part of the care team?
So yeah, that's a great question. I really, from the start of this in Brazil, starting with Bruna when she just finished her master's degree and did her dissertation, man, I remember those days. I remember her giving that dissertation. It was great. And you think of personal growth, there's a shining example, and look where she's at today. She was really instrumental in the startup of their nursing staff to the continued success of that program. And they identified her early on as someone with strong leadership skills, dedication, and passion for the profession and for her patients and their outcomes. And she continued to advance her career and turn that in turn advanced their program into a center of excellence. Their program has created modules, learning curriculums. They covered a variety of learning experience to meet the needs of all. And they run the spectrum of anything from nurses to RTs to fellows, creating a cohesive environment and learning needs. And it pushed their program forward to a center of excellence, and they're just launched off from there. Moving on then, I joined in India, and that was truly a first startup for me, seeing a program go from, infancy up to where we're at now. And I've been able to watch Christy and Gita. These are some nurses that are there, evolve their leadership roles there and blossom from really shy, trepid nurses to strong, independent, assertive practitioners as their knowledge and their confidence has advanced over the years. Now they're leading seminars, they're invited as expert speakers, they're working on publishing, and they're really widely respected in other like programs and in their profession. So it's really truly that experience and that journey of novice to expert, learning that you see a true nurse go through. So, you know, like a take home for me, the last visit that I was at, I got to see Gita do CPR teaching, which you'd think is pretty easy. And she did this as part of their homegoing care for these patient families, for the parents and the families. And she had to really teach through all levels, some illiterate, some very educated, you don't know what you're going to get, and give them the skill in a short period of time to be able to care for these complex patients. The value that these nurses bring to the table, bring to the patients, and bring to these families is astronomical. And you can't, they are the backbone, as I said earlier, of what shifts and makes these patients be as successful as they are.
Thank you so much. It's certainly something we see that is just amazing. Bruna, we know that investing in nurses impacts the outcomes of children with heart condition and tends to improve the organizational commitment and reduce staff turnover. Can you tell us what it's been like for you and your colleagues as you've gone through this journey with Children's HeartLink?
Yes. Well, uh, I'm a little biased because I love Children's HeartLink and all the volunteers. We've been partners since 2009, and we say that it's not a partnership anymore. It's like a friendship because it's an um, ongoing transformation and an ongoing help that they give to us, especially after COVID with all the easy Zoom meetings and everything that technology has brought to us. We have this close relationship with the volunteers, not only through the visits, but also online in various ways. But it has been transformative. Cardiopedi Brazil has evolved not only with the clinical competencies, but also the way that we lead our team, the way we communicate and care as teamwork, really. The support and the presence of the volunteers have been key to this change. So when they come, the bedside teaching is especially impactful. We see that it goes beyond the theory. It becomes like a lived experience. We can see exactly how they do it, and they teach us, and that goes a long way. We've gained technical expertise, but more importantly, through seeing them either in their visits to us or us visiting them, we have reshaped the way our culture, you know, in a more collaborative way, patient-centered. They taught us that very well. The patient has to always be the center. Forget egos, forget hierarchy, taking things personal. So that was like some great things that we've learned. And having them physically present in our unit, guiding us hands-on, it really helps and makes lasting improvements for our outcomes. I have personally gone to the US a few times because of my English and having done schooling in the US. I'm able to really provide this link through translation for some of our teammates. So when I go and we go, we can see the reality. We can see what they teach us when they're there in our service. And that is just amazing. I'm here in Boston Children's Hospital for 15 days, along with 4 of my team workers, and we're here to learn ECMO. And today was our first day, and we've seen so much. You wouldn't believe it. Like, it'll definitely change the way that we care for our patients, and I'm confident that we'll be able to start an ECMO program that is really a lot stronger than we could ever think of. And what's really interesting is now, as Cardioped Brazil is a center of excellence, we are able to help other centers, not only in Brazil, but also we can start a partnership with Africa, with Angola. And so we're very excited to be able to teach what the volunteers taught us. And so we're very grateful to be able to have this opportunity as well. So that's just a little bit of my thoughts on that.
That's great. Recently, I had the ability to and the privilege to visit Cardioped Brazil, and I was impressed by the complexity of the cardiac patients and all the nurses and the physicians, everybody's enthusiasm to learn everything they can to improve patient care and positively impact the patient and parent experience, though there are some really real challenges. So, Bruno, what do you think your teams have shared back to the medical volunteers you've worked with, and how has that impacted your work?
Well, I think, well, the volunteers always come and they say, "Oh, we learn with you as well," and that was always really hard for me to say to think that that was true. But they always come and they always say that, and I think we share with them like our creativity and resilience in working in a resource limited setting. I think we often have to adapt and find innovative solutions and for our care. I believe that perspective enrich the visitors, and also I always try to remind them how lucky they are and everything that they have to give great care, and how they inspire us in doing that as well. But we share our dedication, and many of the volunteers have told us how our passion and teamwork remind them of why they volunteer. And that's, we feel really good when they say that, because we're so grateful that they're there. uh, but we've always taken away a lot from the volunteers. Some of the greatest lessons have been communication and leadership and quality improvement initiatives, because those are areas that we find that we can see some sustainable growth as we go along. They taught us some incredible ways to make impactful changes that doesn't require much money or advanced equipment. So sometimes it comes down really to communication strategies and clear roles and strong commitment and good leadership and doing what's right for the patient. And that mindset has transformed our daily day-to-day work and how our team gets along with each other and help the patients. So I think those are the main ones.
Thank you. Jody, what do you think are some of your biggest takeaways you've had from your different training partnerships?
Right. Bruno really touched a lot of it, but really it boils down to there's no one single right way to do most of anything in medicine. I mean, that's really how it is. And there are a lot of factors that need special consideration when you're coming into these programs, which you can't necessarily tease out without experiencing that human connection that, those site visits give you, right? I mean, we're learning cultural differences, trying to understand what their barriers are, anything from their learning differences to the diversity that they're faced with, the socioeconomic barriers that they're seeing or that they have within their community, even things like the government support, the models that with the government involvement or their limitations that limit these programs, and the educational needs and levels of all of them, not just the nurses that we're training, but what about the fellows? What about the residents? What about the surgeons? And then what about the families? Because it's just not one area. It's collaboratively, collectively whole. And you cannot get that via Zoom meetings. That is a partnership and a relationship that is built. Its trust is grown, it's understanding, and it takes that those site visits to kind of build that and to propel that forward. So once all those things are hammered out, you can uniquely create and tailor learning experiences to get programs up and running successfully. And you get buy-in from parties, and you increase retention within those programs. It gives you, the other takeaway is it gives you the opportunity to model behavior. And I think Bruna kind of touched on it. You can tell someone that you need to be assertive and you need to be, speak up and you need to be the leader of this thing. But if they have no voice, or they don't understand what that looks like, it's that modeling and the mirroring of that behavior that really hits it home for them and says, I can do that. They did it. It's successful. I can do it. But you got to see it to believe that it works. It's hard to understand how programs work or how something can work well if they don't even know what they're asked to be doing. So when we go there and we mirror what we're asking them to learn, this is a really priceless piece of advancement within them. And these things can't be done by Zoom meetings or just mentoring alone. It takes human connection to do those things. It's that pay it forward synergy that you kind of want to, get involved in. And lastly, it's seeing the success of these programs is, obviously rewarding, and it's joyful. It's what we want. It's our goals to make sure that they launch and they pay it forward themselves. But watching them learn from hardships and failures is important too, because this is where resiliency is built, right? It's where they learn, I will never do that again, or I don't want this to happen to the next to the next child or to the next patient. This is where personal growth happens in moments like that. And when you're with them to kind of help them through those patches and say, all right, let's pick ourselves up by the bootstraps. Let's relook at this and start this all over again. That's how, challenges are overcome, and you learn, like that didn't work so well. Let's go back to the drawing board and let's do it so that it can work for your program. So this is what drives learning and impacts change.
Thank you so much. Bruna, what do you think are the biggest challenges that you're going to face in pediatric heart care, and how have you overcome them or plan to overcome them in the future?
Yes, so I think our challenges are in some ways the same challenges I think that, the whole world is having, which is staff education and training of new professionals and retention of these nurses. And I think those are some of the greatest challenges. So pediatric cardiac intensive care really requires a highly specialized training and skills, and we've never had that here in Brazil. At least, like, there's differently than in the US, where there's tons of educational opportunities and different certifications for specialized care. Here in Brazil, we didn't have anything especially for nurses in pediatric cardiology. And with Children's Heart Link's help and the funding that they receive, and with the help of the volunteers, we were able to develop a postgraduate program for pediatric cardiac nursing. And today we have more than 130 nurses from all over Brazil that were trained in a formal training and with practical hands-on training and mentorship. And I really hope that this can start to change the nursing care for this specialty in Brazil, especially in the areas that there's really a lot less opportunities. The volunteers have always taught us how much it's important to have an empowered nursing team, especially during their visits. They're, like Jody said, and they're able to show us in firsthand how to do that. It's because it's hard for us that we've never had a voice to make that change. And even to have them here and showing what really nurses can do and what they can be, it's really inspiring to all the nurses in low and middle income countries. So I'm going to do just talk about an example. We were really struggling with post-Fontan procedure patients and their management. And Jody came in 2015, and she was in our unit for a week along with some other volunteers. And we were having a post Fontan and we were terrified. And she's like, no, I am going to be here the whole time. I'm not leaving. And she stayed all night with a patient. And I was translating for her, for the team. And at that night, we were able to learn more than any textbook, more than any Zoom meeting. She just gave like a show on what a nurse can do. She changed drugs and she taught us, about fluid maintenance and balance. And um, the doctors were like in awe. And that's when we were really able to translate, everything, the clinical reasoning, the techniques. And not only did that child survive, but it completely changed how we understood and managed the Fontan patients today. And so that night, Jody, was a turning point, and we have improved our results since then. And we never forget that. And that's just one example of what many of the teachings that the volunteers helped us with. And so I get very emotional about it. So, yes, there's no way that these visits are just so powerful. And so, yeah, thank you.
Well, we just have one more question that we thought of, and then we're going to be able to hear from all the people that came tonight to listen to us and see what their questions are. And some of it looks like you kind of answered. But if you could tell us, Bruna, and then we'll have Jody answer the same question. If you could tell someone the one singular reason why they should support nurse education through Children's Heart Lake, what would it be?
One, so that couldn't be. But I think the main thing is that nursing education saves lives, and not just one, many. Every nurse who's trained through Children's Heart Link becomes a multiplier of care and of what she learned. So thanks to the generosity of the donors, the volunteers, the time that the volunteers put into this. They're able to come to our hospitals, work with us, help us grow. They bring us new knowledge, yes, but they also bring encouragement and long-term impact. They're not we are not the same team that we were before this partnership, and I can definitely say that we're better for our patients, for our families, for each and every one of our team members. So we're deeply thankful to all the donors that make these visits possible, these trainings. Your support doesn't just fund a visit, it transforms lives and strengthens care for children who otherwise wouldn't have access to this level of care. So, yes, that's it. Thank you.
Jody, you have to try to improve upon that.
Oh man. Oh man. That is why I do what I do, right? This is why I do this. It's people like Bruna and all these nurses that you see such impactful change. And you see these, I've went to these sites, I see these nurses, I see what they've done, where they've started and where they've how great they're doing. And it's hard to believe when you're the one who's learning that you're like, am I ever going to get this? Am I ever going to get this? And then before, it's that aha moment. But the honesty of it is nursing and nurses, they're the heart and soul of healing. Really, I mean, nurses spend more hours with these patients, these little babies, and these families collectively during their whole perioperative period than any other team member. They're bedside, they're doing 8, 10, 12-hour shifts day after day, 6 days a week. They see these patients, they live it, they breathe it. These are they want good outcomes for them. So we all want them to learn. However, their knowledge in basic cares, they're the least trained people, but have the most contact with these patients. They have the least training opportunities, the least resources to improve. And that's the chink in the armor when it comes to this. This is where we need to step up and pay it forward, like let's get you going. Residents, fellows, physicians, they have ongoing learning that they do. They're invited to speak at seminars. They continue their education. But these nurses, they graduate out of nursing school, and if there isn't someone to lift them up and build them and move them forward, there is nowhere for them to go. And you learn best by mentoring, you learn best by experiences. And this is what it's all about. Like, let's get these nurses up and going. Let's give them opportunities and resources to improve, because that's what matters.
That's amazing. Well, we definitely have time, and we were able to convert this from a webinar to just a meeting so everybody can speak and we can have an interactive conversation. We have teams from Children's Heart Link, as well as the three of us that have all volunteered. Bruna's a volunteer in Angola, so now we've both been receivers and givers. So we'd love to hear what questions have come up from the people that are listening with us today.
This is Erin. I will kick it off, just because I would love to hear a little bit more from Bruna about the post-grad program that was created. I'm just curious, tell me a little bit more about the history of that. How long has it been going, and how many are you training on an annual basis? And we've been to add to this and finalize it. We've been hearing about that ripple effect. So I'm just curious, out of the number of individuals trained, then, what does the normal caseload look like for a nurse going forward? And I'm guessing that you're impacting, just through your training program, hundreds of thousands of people.
Yeah. With your help, thank God. Uh, without the volunteers, without all the knowledge that we had received, and I wouldn't be able to have done this. So first, I was a nurse educator, and so I was able to see also how the nurses needed more information, more education. They were doing things just because that's the way that they've always done it, and they didn't know why they were doing it. And our patients can't have that. Like, they need knowledge behind it. They need to know why they're doing it and what the impact will be if they don't do it exactly how it should be done. And when we go look for information, there is none in Portuguese. There's no, and nurses in Brazil, hardly ever they speak English, or they understand, or they read. So really, there was really lack of information for this really important healthcare provider that is actually with the patient the whole time. And they would always depend on someone else, to take their time to teach them, and most of the time they wouldn't. And so it was stressful to see how they wanted to learn and didn't have the opportunities to do that. So mentioning that to Children's Heart Link, and thinking about how I could make that happen, I thought, why couldn't we have a nursing course that would talk about pediatric cardiology only? And of course, in our government here, like pediatric cardiac intensive care is not a specialty yet. That's a gap that we're willing to fill. But for nurses, we don't have that. We've never had that. So I said, well, maybe we can include a post-grad course that could be certifying them for pediatrics and cardiology. And so in that post-grad course, we talk about everything that can happen in pediatric cardiology, all of the congenital heart defects, and how nurses can take care of these patients. So it's it's 350-hour, 18-month course that they can take the classes online, and they can do the hands-on. They need to do the hands-on in practice and in person. And before COVID, it was all in person, and we had fewer from all over Brazil, of course, because of the hardship of um, traveling. So after COVID, when we had the opportunity to do this course online, we were able to expand this to more nurses in Brazil. And I get to hear from nurses in the north and northeast of Brazil, places that really need, better care for congenital heart disease children. And they're telling me how they are empowered, how they feel a lot better to take care of these patients, how the doctors feel more confident that they're on in their shift. And that makes me feel just so good, because that's all that we want to hear. That's what nurses are capable of doing when they have the tools and when they have the knowledge. And so the funding from Children's HeartLink has been especially important, because they can help nurses with scholarships. And so they're able to, of course, take these courses and be able to, and they also get what they learn, and then they teach the other nurses that they work with. And so that's just, great. We've been doing since 2018, and there has been four classes already. So more than 130 nurses have been trained already, and the numbers keep growing. So we started with a class of 20. Now we have a class of 49 nurses. So exciting.
That's amazing. I think we had one other question.
Mhm.
Yeah, go ahead.
We do, and it is from Sue, and just
I think
a
I'm.
comment.
Yep.
Oh, did you get to unmute yourself?
Yes, Bistra unmuted me.
Oh, fantastic.
Yeah, just raise your hand and Bistra can unmute anyone.
So first of all, you are so articulate about what we do in training, and Bruno, what you and your team has done. It's just absolutely amazing. I'm curious, when you have been involved in training others, what's the biggest surprise that you've encountered?
Jody?
I think it was
Man,
for
it's
you,
everything.
Bruna.
Yeah, it's everything. You go to these sites, and you think when you go, you try to prep when you go for what their needs are going to be. They kind of give you a list of their needs. You try to keep a finger on the pulse with these programs throughout all of this. But when you get there, it's all a surprise. There is nothing that's laid out, nothing that's straightforward. They don't know sometimes what they're asking for. They just know that to make a program successful, they need to learn these things. However, you get there and you realize what they're asking for is not at all what they actually need. So you got to pull the reins a little bit and take them back and say, all right, we'll get you there. We'll get you there, and we'll give you this content. But before we get there, you need these building steps to get yourself successful. You can know a lot about a lot of things, but the critical thinking is something that is taught, it's learned, it's evolved, evolved over experiences. And I think it's the challenges are different in each country that I've been to, and trying to tailor their needs, I think, is unique, right? Like, what's so great about this is, I think at this point where Bruna's at and where I'm at, you pull experiences from other sites you've been to. you learn from other sites to say, hey, you know what? We had the same issue in Brazil, a little different, but kind of the same. And this is the approach we took. And this is what made better outcomes, right? So you take your experiences and you tweak them, tailor them, and your life experiences you could pass on and it makes changes for them. So that I think that those are some of the surprises that you learn along the way. And they're valuable. If you can keep a volunteer to keep volunteering and they, just learned experiences and a pot of gold that you can just, pass on. And it's the same with the nurses. What happens then is these nurses, you get higher retention and you come back and you see the same nurses. If you build it, they come. They want to be part of something big. Who doesn't? Who doesn't want to be supported? No one wants to come into a job where you can harm anyone. May I do no harm? And I think, everyone's in that whole boat. And if I know that I can be empowered by the people that I'm around, that we all have the same goals for good patient outcomes and safe patient care, man, who doesn't want to be a part of that? So those are some pretty aha moments for me.
Thank you.
I don't
Bruno, what has been surprises to you as you've passed it on, as you've hired new nurses and gone to other places, because now you're paying it forward? What's been a surprise to you?
Yes. Well, the recent experience, in Angola, I think that same thing. When we went to visit, we were expecting something. Like they had a list of things that they thought that they needed, and I think the biggest surprise to me is to see how much they want. I mean, I knew because I also wanted to learn so much, but when you see it firsthand, how thirsty they are to know everything and to change things, they want to change. And when you get there and they wanted to see exactly what you said, Jody. Like you have to take a step back and say, no, first we need to do a bunch of other things, and it's going to take time. You need to calm down. It's going to happen, but it's going to take a long time. But we're here with you. We're going to make it happen. And to have this ongoing support is really helpful. And so yeah, that's I think the biggest surprise also to me was how much I loved doing it. I thought I didn't know anything to teach. It's incredible how when you get there and you see things and how much they didn't know. And I said, oh, no, I know this. No, here's how you should do it. 'Cause we went through the same problem and this is how we fixed it. And um, since we are in a low and middle income country as well, I could even say a few things like, no, you're going to skip steps and forget that doesn't work. Here's how you're going to do it because we've suffered and you don't need to suffer. Now you're going to do what we did and it's going to work. So it was really nice to have this experience too. So,
To
and
add on,
having them come to us, like to our sites, it's always a surprise. They will teach us things that we never thought possible. So that's the other way around, right? They come and we're thinking that they're going to teach us one thing, and all of a sudden they're like putting out fires, and we're with a pan in our hands, just like trying to write everything down, not forgetting anything because they're teaching us like a bunch of things at once. So. And none of what we asked for, everything new.
I think that's so true. And I think that goes on both ways. I think some of the other surprises now that I'm starting to like muster this question a little bit better is their limited resources and what as a country they can and cannot do. You think, oh yeah, this is no big deal. What seem to be the simplest solutions are their biggest barriers. Literally their biggest barriers. You're like, how can this be what's holding us up? Like, really, this is how this is. So it's those you can't learn about those things until you're there and what makes it. And to watch the innovation of these nurses, right? Like, you want to talk about MacGyver skills. This is where you start to learn it, right? Like, all right, we don't have these things, right? You don't need all these things. Let's take it back to basics. And what do you have? What do you have? What do you need? And what can you do without? And you start to build these like critical thinking moments, like a think tank, and like things evolve from there. So it's great to see that when you model that kind of behavior, that you like, look at, we're going to think about this as a whole. What do you think of this idea? All right, let's move forward with that. They start to do this on their own. And you come back, and the next time you visit, it's like, wow, now that was creative. I don't know that I would have thought of that, but that works well. It's safe and it works within your country. It might not be something we do because we have affordable health care, we have resources to other things, but until we can get you to where else you ever need to be, this is absolutely appropriate. So those are some pretty great aha moments I think I see between cultures that I'm like, wow, that's a learning lesson for me, you know?
That's great. Looks like we have one more question from Karen. Let's see. I think Bistro, there we go. You might have to unmute her for us.
There we go. I think I'm unmuted now. Can you hear me?
Perfect.
Can you hear me?
Yes.
We can. Thank you.
Oh, great. Well, this was really exciting to listen to. Bruno, I actually am in Brazil, in Rio. I'm American. I've lived here for well over 40 years, and I'm on the advisory board for policy and advocacy for Children's Heart Link. So this all brought back memories. I am a public health specialist. I worked in reproductive health for many years. And in the 80s and 90s in Brazil, we taught way more than 1,000 nurses how to insert IUDs. It was very, very new. And so this reminds me of the circumstances seem to be a little bit similar. I joined a little bit late, so you might have already brought this up. But when we were training nurses to insert IUDs back then, the physicians were the gatekeepers, you know? So it was very important to have a physician champion. And I haven't heard so far, and maybe I missed it in the first part. Are physicians gatekeepers? Do they try to limit the role of nurses, or are they extremely happy about all this training that's occurring and the new skills? And if they are gatekeepers to a certain extent, do you have any strategies? And this is not only a question for you, Bruna, but others who have trained in other countries. Do you have any strategies about how to get these physician gatekeepers on board so they can promote actively the involvement of nurses in pediatric cardiac care?
Well, I'm sure Jody has a different perspective, but from my way of looking at it, I've been working with Cardiopedi Brazil since I started, and when we started, nurses didn't have a voice. We were totally dependent on what the doctors, had to say, or the visits were completely doctor-led, and the nurses would just listen and do whatever, was told, and just keep their thoughts to themselves. After the volunteers started to come, and after we went to the US and saw the visits that were interdisciplinary, and the nurses talking about what they thought and what they, what were their opinion, and how the central lines needed to come out, and they were the keepers of the the invasive devices, and they started to teach us how, no, you need to speak up, no, you need to do this, it's your responsibility. And they also started to talk a lot to our doctors, especially to our leader, Dr. Ulysses Crody. He is the surgeon, the main surgeon, and the coordinator of the service, and he is a visionary, and he's very, he needs to have everything correct, and he was always our guide, and he wanted things his way or no way. And Children's Heart Link volunteers, and he will tell you this, were started to change him slowly, and him as the leader, changing started to inspire other doctors. Well, if he's changed, if he's telling that we need to listen to the nurses, then we better listen too, and then all of the team was started to think in this new culture, this new hierarchy, this new, well, the nurses are part of our team as well, and they're just as important as the doctors. And today, when I go into an interdisciplinary rounding of the patients, I almost cry because I can see how it changed and how the doctors are actually partners of the nurses, how it should be. And they ask, nurse, what do you think? You're at bedside. What's your thought on this? I literally, I almost cry. I'm like, oh, thank God that we got to that point. It took years, but it finally happened. And I'm telling you guys, it only happened because we were able to see and have this guidance. And today, I particularly I'm invited to give lots of talks on nursing empowerment. And I always tell my students from the postgrad course how important they are. And I know that there's doctors watching in these talks, and I always tell them, doctors, you need to listen to your nurses. You need to empower them. They need to speak up. And so I am so proud to say that I learned, and they have learned as well. They changed, and that we're trying to change this in all over Brazil with the help of Children's Heart Links, because we know that this is possible, and we're making sure that everyone knows that our success comes from a lot from this. So yeah, that's my perspective on it. Jody was able to see and to talk to Dr. Ulysses and change him as well. And
oh boy, I
all of
remember
our
those.
intensivists.
We had to, sometimes you got to give them the old 1-2 punch. Like, this isn't about you. This is really about, this is bigger than you. You need to respect. There is a respect that is a mutual respect that needs to happen. And even still today. So I think you want to preach this, and you want people to buy in. And like, if someone is intimidated or scared by you, they're not going to work to their top performance. We really tell this to the physicians, the cardiologists. It doesn't matter. Like, this is a safe space. This is an open space. Like, if you belittle them or you don't get them involved, they're never going to speak up for you or do things for the patient. They're going to let you fail, and you're only as strong as the weakest person on your team. So we really encourage them to, we do bedside rounding, right? And it is that what the nurse says on those rounds, you listen, you don't interrupt, you give them a chance to explain what it is they're seeing and what are their concerns. And then you validate their concerns, or you validate the reason that you shouldn't be concerned, whatever it is. That's a learning moment for them. And we're not doing lightning rounds here. We're doing rounds so that everybody gets a chance to speak what they need. We're taking it to this point where we're asking, and I know this happened in Brazil too, where these people have buy-in. They realize that it's not just about the learning they do. You got to share what you know, right? You shouldn't, knowledge should be shared. It shouldn't be coveted or anything like that. You should share what you know, right? So we've asked them to do chalk talks, so that we're leaving here, but you need to do basic either bedside moment, 1 moment elevator speeches where you're like, remember, this child, here's the basis of their congenital defect. What are the key things for this? And you just do gentle reminders. And then maybe it's weekly chalk talks where you just piece apart a part of the care that you're seeing, the physiology behind it, the anatomy behind it, and why you're doing what you do. These little pieces show that they care. They're taking time out of their own schedule to make sure that your learning gives people opportunities to learn. And it makes these nurses feel like they're a valued piece of the team. And so we really try to hit it home with everybody, but you got to model that behavior, and you have to show them that, nurses are, hey, look, I'm not taking this. Like, this is, you know, you are going to be the protector of this child, right? You are the protector of this child, and you will not let no one hurt this child. Like, what is it that we need? What are the barriers here? And you teach them those things. So I think it's great.
Yes, that's very good, Jody. I also always tell my doctors, and that's what they've been saying. Like when they go at bedside, I always tell them, please, when you go to change a drug or anything that you're going to do to the patient, don't just go and do it, or don't just ask to do it. You tell them, I am doing this because I'm thinking this could be better this way. This is the reason why I'm thinking of doing this, because then you're passing on what you know to that nurse, and they can be partners and make the results even better. So it's happening. Yay.
Great.
Well, thank you all so much. I think we're at time, and what a great conversation to have and to listen into. Such amazing perspectives. Thank you for sharing. And again, I think everything that we heard from Jody, from Bruna, and Anna, it really comes down to the people who believe in Children's HeartLink and our model of the train the trainer approach. We really couldn't do it without the donor support, and I think that this just goes to show that every dollar that you invest in Children's HeartLink has such an immense ripple effect, across the world, literally. So for all of those who have given to support the Nurse Training Fund, to support our work, thank you so much. Anna, Jody, Bruna, thank you for joining us and again, volunteering your time to be here and celebrating Nurses Week with us and Nurses Day. So I'll be sending out the Mary McMahon Busch impact report to everyone who attended the call, and then we'll also capture this as a recording and share it out on YouTube later in the week. So look for that to come. And again, if you have any questions, please feel free to get a hold of one of us. I'm at childrensheartlink.org, and you can find me via the website if you need me. And again, thank you all for your time today.
Well, thank you. I feel so happy. Jeff, thank you so much for keeping this going. You are representing all the donors from Children's HeartLink, and I just want to look in your eyes and say thank you so much. You are so blessed, and I'm sure you have so much coming back to you in various ways. So thank you. You're saving so many lives and for helping us nurses. Thank you.
Thank you.
Thank you,
Thank
Jeff.
you,